Right now, nearly half of all adults in the United States are living with high blood pressure. Half. And here is what makes that number so alarming. The majority of them do not know it. Not because they are careless, not because they are avoiding doctors, but because high blood pressure, what physicians call hypertension, almost never announces itself loudly. It moves quietly. It works in the background. It earns its nickname for a reason. They call it the silent killer. But silent does not mean invisible. There are signs, subtle ones. Signs that most people brush off as stress, poor sleep, or just getting older. Signs that your body has been sending for months, maybe years, while elevated pressure quietly damages your arteries, strains your heart, and chips away at the vessels feeding your brain. This video is going to change how you read those small, easy-to-ignore symptoms. We are covering 7 of them today, and I want you to stay until sign 3, because that one catches almost everyone completely off guard. It is the sign people most consistently misattribute to something entirely unrelated, and understanding it could genuinely change the conversation you have at your next doctor's visit. Do not skip ahead. Sign 3 is worth every second of the wait. What you are about to hear is not meant to frighten you. It is meant to prepare you. High blood pressure is one of the most manageable conditions in all of medicine, but only when people know to look for it. The problem is that most people wait for something dramatic, chest pain, a collapse, something unmistakable. But your body rarely works that way. It whispers before it screams. These 7 signs are the whispers. Learn to hear them now, and you put yourself back in control of your own health. Let us get into it. Sign 1, morning headaches. You wake up, and before you have even reached for your phone, there it is. A dull, throbbing pressure across the back of your head or settled behind your eyes. You think, bad sleep. You think, dehydration. Maybe you did not drink enough water yesterday, or you stayed up too late. But here's what most people never consider. A persistent headache that greets you first thing in the morning, especially at the back of the skull, can be one of the earliest and most overlooked indicators of elevated blood pressure. Here is why. During sleep, your blood pressure naturally decreases. This is called nocturnal dipping, and it is a normal, healthy part of how your cardiovascular system rests and recovers overnight. But in people with hypertension, this dip either does not happen fully, or blood pressure spikes sharply just before waking as the body shifts back into an active state. That sudden surge in pressure within the blood vessels of the brain can trigger what is known as a hypertensive headache, typically felt at the back of the head, and often worse during those first few minutes after standing. In real life, this is almost always explained away. Headaches are so common that they rarely raise alarm. We blame screens, caffeine, tension in the neck, a stressful day ahead. All of those things cause headaches too, which is exactly what makes this sign so slippery. But if your headaches consistently appear in the morning, before the day has given you any reason to be stressed, and they follow a pattern that is worth paying close attention to, left unaddressed, chronically elevated blood pressure places continuous strain on the blood vessels supplying the brain. Over time, that strain increases the risk of stroke, vascular dementia, and lasting cognitive changes. A morning headache is not just a minor inconvenience. For some people, it is a message from a system under pressure. Sign 2, vision changes. And this next one, I want you to pay very close attention. Most people treat vision problems as an eye issue, something for an optometrist to sort out. Blurry vision, brief flashes of light, occasional dimness, or a subtle narrowing at the edges of your visual field. These tend to get attributed to screen fatigue, aging, or simply needing a new prescription. But your eyes and your cardiovascular system are connected in a way that genuinely surprises most people. The retina, the thin light-sensitive layer at the back of your eye, is one of the only places in the entire human body where doctors can directly observe blood vessels without any imaging equipment. They look into your eye and they can see, in real time, how your blood vessels are behaving. In people with elevated blood pressure, those vessels show damage early. Changes in the small vessels of the eye, a condition called hypertensive retinopathy, can appear before almost any other symptom, before headaches, before breathlessness, sometimes before a formal diagnosis has ever been made. In real life, this might feel like vision that comes and goes, slightly blurry one moment, fine the next. A subtle haziness you keep meaning to get checked, but never quite prioritize. More frequent floaters, a visual field that seems marginally narrower than it used to be. Here's the part that surprises most people. Vision changes driven by blood pressure are not always painful. They can be so gradual that your brain simply adapts. You do not notice you are seeing the world slightly differently because the shift has been happening one quiet day at a time. Think about the last time you noticed your vision seeming slightly off. Did you follow up on it? Sign 3, frequent nosebleeds. This is the one I told you about at the beginning of this video, and I want to explain exactly why it deserves that kind of buildup. Nosebleeds. Most people think of them as a childhood nuisance. Dry air, a bump to the face, seasonal allergies. And those things absolutely cause nosebleeds in perfectly healthy people, which is precisely why this sign gets dismissed so consistently. The familiarity of the symptom is its best disguise. But here is what changes the picture entirely. Frequency and context matter enormously. When blood pressure is significantly elevated, the increased force pressing against the delicate blood vessels lining the inside of the nose can cause them to rupture. The intranasal passages are lined with tiny, thin-walled capillaries, among the most fragile vessels anywhere in the body. Under normal pressure, they hold without issue. Under consistently elevated pressure, even minor spontaneous movement or mild irritation can cause them to give way. The distinguishing characteristics are these. A nosebleed connected to blood pressure tends to be more difficult to stop than a typical bleed, often occurs with no obvious trigger, and may come from deeper in the nasal passage rather than at the very tip. It recurs. If you are an adult who has started experiencing nosebleeds more frequently, with no obvious explanation like extreme dry climate or allergy season, that pattern deserves a blood pressure reading. Let that sink in for a moment. People live for months dealing with recurring nosebleeds, assuming it is just something that happens to them, never connecting it to what is happening inside their arteries. The link is not intuitive, but medically, it is well established and well documented. And the nosebleed is only the visible part. That same excess pressure is working on blood vessels throughout the body simultaneously, in the kidneys, the heart, the brain. The nosebleed is a small external window into an internal pressure problem affecting systems you cannot observe directly. Before I continue to sign 4, I want to ask you something directly. Of the 3 signs we have covered so far, morning headaches, vision changes, nosebleeds, have you personally experienced any of them? Drop a yes or a no in the comments right now. It takes 2 seconds and it genuinely helps me understand what content is most useful to make for you next. Your answer matters more than you think. Sign 4, shortness of breath. Stay with me, because the connection I'm about to explain is one that people rarely piece together on their own. Feeling winded is easy to rationalize. You climbed a flight of stairs and needed a moment to recover. You walked briskly and found yourself breathing harder than you expected. You told yourself you were out of shape, that you need to exercise more, that this is just what getting older feels like. And sometimes that reasoning is correct. But here's the physiological reality that changes things. When blood pressure is chronically elevated, the heart is forced to work against greater than normal resistance with every single beat, thousands of times a day, every day. Over time, this causes the left ventricle, the heart's main pumping chamber, to thicken and stiffen. This process is called left ventricular hypertrophy. A stiffer heart does not fill and empty as efficiently. Fluid can begin to back up into the lungs, and that back pressure is what creates the sensation of breathlessness, particularly during exertion or when lying completely flat. In real life, this does not feel like a medical crisis. It feels like aging. It feels like normal decline. People quietly adjust their behavior around it, taking escalators instead of stairs, slowing their pace, without ever asking why the change happened in the first place. Here is what most people do not realize. The heart can undergo meaningful structural changes from sustained hypertension long before breathlessness becomes hard to ignore. By the time the symptom is noticeable, the process has often been quietly progressing for years. Sign 5, heart palpitations. A palpitation is that moment when you suddenly and uncomfortably become aware of your own heartbeat. A flutter, a skip, a heavy thud, or a racing sensation in your chest. It can last a few seconds or stretch into minutes before passing. Most people experience occasional palpitations and dismiss them quickly. Caffeine, anxiety, and poor sleep are the usual explanations, and they are legitimate ones. So it is genuinely easy to explain these away. But here is what most people are never told. Chronic high blood pressure creates an electrically unstable environment inside the heart. The structural changes that come with sustained elevated pressure, the thickening, the stiffening, the altered geometry of the heart muscle, can disrupt the electrical conduction system that coordinates each heartbeat. This increases the risk of arrhythmias, which are irregular heart rhythms. Atrial fibrillation, one of the most common and consequential arrhythmias, has a well-documented association with untreated hypertension. In daily life, this shows up as that occasional fluttering you note and then promptly forget. What matters most here is context. Palpitations during heavy exertion have many benign causes. Palpitations that occur at rest, and especially ones that are becoming more frequent over weeks or months, are worth discussing with a doctor, not filing away. What I am about to tell you about sign 6 changes the picture even further, because almost no one connects this next one to their cardiovascular system at all. Sign 6, facial flushing. Facial flushing, a sudden redness across the cheeks, forehead, or neck, usually accompanied by warmth and sometimes mild discomfort, is one of the most commonly misread signals the body produces. We associate it with spicy food, warm rooms, alcohol, and embarrassment. All of those things genuinely cause flushing, which is exactly what makes this connection so easy to overlook. Here is the mechanism. When blood pressure rises sharply, in what are called hypertensive spikes, brief bursts of significantly elevated pressure. The blood vessels near the surface of the skin, particularly in the face and neck, dilate rapidly. That dilation pulls more blood close to the skin's surface, producing the familiar red, warm, flushed appearance. In real life, this can look like episodes where your face suddenly goes red for no clear reason. You are not eating anything spicy, you have not been drinking, you are sitting quietly, and your face becomes hot and flushed, and then it passes within minutes. It may happen during stress or entirely without warning. Pattern is everything here. A flush after a glass of wine is unremarkable. Recurring, unexplained flushing episodes, especially when paired with other symptoms on this list, belong in a conversation with your doctor. But here's the real question. Why does nobody talk about this particular connection? Because we have been conditioned culturally and practically to associate flushing with food, drink, and emotion. The cardiovascular angle sits entirely outside most people's awareness, which means this sign gets missed over and over. Sign 7, cognitive fog and difficulty concentrating. You are in the middle of a sentence and you lose the word you were reaching for. You walk into a room and cannot remember why. Your focus feels scattered and slow. Tasks that used to feel natural take noticeably more effort. You blame stress. You blame age. You blame the pace of modern life. And I want to be clear, most cognitive fog is caused by exactly those things. But there is an established and deeply underappreciated connection between blood pressure and brain function that deserves far more attention than it receives. The brain is the most blood-dependent organ in the body, consuming roughly 20% of the heart's entire output, despite representing only about 2% of body weight. It requires a constant, stable, oxygen-rich blood supply to function well. When blood pressure is chronically elevated, the small blood vessels deep in the brain's white matter are among the first structures to sustain cumulative damage. This is called cerebral small vessel disease, and it is directly and consistently linked to cognitive decline, memory impairment, and slowed processing speed, changes that can begin appearing years before any formal diagnosis of a cognitive condition. In real life, this does not feel like a neurological event. It feels like you are simply not as sharp as you used to be, like your memory is going with age, like it takes longer to find words, follow a fast conversation, or switch between tasks. These shifts are subtle. They accumulate slowly, and they are almost universally dismissed as normal aging. They are not inevitable. For many people, they are preventable, if the pressure problem driving them is identified and managed early enough. Now, I want to return to something I told you at the very start of this video. I said sign 3 would be the one that catches most people completely off guard, and I hope now you understand exactly why. Nosebleeds, not chest pain, not dramatic breathlessness, not something that sends you to an emergency room. A nosebleed, so ordinary, so mundane, so completely benign in isolation, that millions of people experience it repeatedly without ever connecting it to their cardiovascular health. The ordinariness of the symptom is precisely what makes it so dangerous to overlook. And here is the deeper insight I want you to carry from this. It is not really about the nosebleed itself. It is about what that nosebleed represents. Those fragile capillaries in your nose are a visible, accessible window into what is happening inside blood vessels you cannot see. The ones in your kidneys filtering your blood, the ones in your retinas processing light, the ones in your brain sustaining your memory and cognition. When they break under pressure, it is worth asking a serious question about what is happening in the systems that do not give you that visible signal. That is not alarmism. That is sound, practical pattern recognition. And that awareness is what this video was built to give you. The single most important thing to take away from everything you just heard is this. High blood pressure is only dangerous when it goes undetected and unmanaged. Once you know it is there, it becomes one of the most treatable conditions in all of medicine. The information is available, the monitoring tools are accessible, and the interventions are well understood. So here is the one action I want you to take today. Not tomorrow, not after the next checkup, today. Check your blood pressure. If you have a cuff at home, use it now. If you do not, most pharmacies offer free readings that take under 2 minutes. One number, systolic over diastolic, tells you more about your cardiovascular health than almost any other single measurement available to you. I put together a follow-up video on the specific lifestyle habits that directly move that number in the right direction: diet, sleep, movement, stress. It is the practical next step from everything we covered here. It is linked right after this one, and I genuinely think it is worth your time.